Michael Morton is getting ready for a pulmonary function test at Estes Park Health.
Okay, thank you.
The 75-year-old Estes Park retiree was hospitalized in 2023 when one of his lungs filled with fluid. He's recovered now, but his doctors want to check his lung function.
My pulmonary physician decided he wanted to see how my breathing was doing. It's just a test to follow up and make sure I'm still doing well.
Bring that back, get it centered inside.
Respiratory therapist Bill Christen is guiding him through the process. The sensitive machine will analyze and test lung volumes, lung capacity, rates of flow, and how gas exchange takes place in the lungs.
It's a non-invasive diagnostic test to let you know how well your lungs are working. And all of that data, once it's collected, is then transferred via our electronic health record to a pulmonary physician.
The pulmonary function test can help with the diagnosis of asthma or chronic obstructive pulmonary disease, known as COPD. The test can also let physicians know how well pharmacological treatments are working.
That's the way. Push it out. Push it out. Keep going. Push, push, push.
Christen has been working as a respiratory therapist for more than 35 years. He has spent the last 3 years working with patients at Estes Park Health. He enjoys the hands-on nature of his job and helping people.
There is a community up here that needs to be served, and I'm glad that we're able to do that. And I think it makes it so much simpler for that patient so they don't have to leave town.
The respiratory therapists at Estes Park Health perform 25 or 30 pulmonary function tests each month.
2.5 minutes left.
They also perform what's called a 6-minute walking test to see if patients need to be on supplemental oxygen or if they need their oxygen adjusted.
Doing okay?
Sam Schwab lives in Big Elk Meadows near Estes Park. His primary care doctor suggested he take the walking test since he has been having some symptoms.
And I've told him I've had shortness of breath, and so he's trying to follow up to see exactly why. We walk a loop in our neighborhood. It's a little over a mile and a quarter. It was getting to where I'd have to stop every 2-3 minutes, catch my breath. When I start to do physical things, I'm short of breath, and my muscles feel fatigue until I actually warm up, and then I can go. He said, yeah, you probably got maybe the start of emphysema, COPD, and so we're just going through the motions to see what we need to do to make my life easier.
Okay, then go.
Respiratory therapist Michelle Heydenreich is the professional conducting Sam's test. She's been an RT for more than 30 years. She likes the job and says it's different every day.
Every patient's different. Everyone reacts to everything differently. Something's always changing, it seems. And then it feels good to make people feel better. Like if they can't breathe, we're their best friend because we have the tools to help them breathe.
Along with outpatient lung testing like sleep studies, RTs also help patients in the hospital with breathing treatments, ventilators, and emergency care. Having respiratory therapy locally is extremely important.
We're at 7,500 feet. People might have problems breathing here, but they go down to even Loveland, which is at 5, they're fine. So it's extremely important that you do it where you live because this is where you're breathing every day.
For Sam, being able to do this simple test where he lives makes a lot of sense.
Estes is much more convenient, and and we've been coming to this facility for 40 years at least. Oh, the personnel's great, and they seem to care.
It's local, so it's nice and close. I don't have to go down the mountain to do tests and that type of thing.
For sophisticated respiratory therapy to help you breathe easier and get back to your life, think Estes Park Health. Mountaintop Medicine. Quality care.